So I got this comment from Jason Slaughter, who says, please don't give this to pregnant women. That was in reference to Prozac or other SSRIs. Now, pregnancy is a very complicated thing. But when addressing treatment in pregnancy, let's start with the first rule. It is the woman's choice. Meaning if she's given the adequate information and consent to say, yes, I want to try this medicine or I don't want to try this medicine during pregnancy, ultimately it is her choice unless there is like an absolute contraindication. But how do I know which medications are safe in pregnancy and which medications are not? Well, doing a randomized controlled trial on pregnant women is almost impossible, especially when assessing for adverse effects. There is no universe where it is ethical to expose a group of pregnant women to a certain medication and a group to placebo, and then measure the adverse effects to the fetus, the baby, and the woman afterwards, right? That you can't do that. So the only way we know about if medicines are safe is observational studies, retrospective studies, meaning studies where women were taking these medications and we looked at data to see if there's a higher incidence of something in the babies or the women. It is much easier to do breast milk studies to see which medications get into breast milk. Not every medication gets into breast milk in the same concentration. For example, out of the SSRIs, we know that sertraline, Zoloft, is the one that's least likely to get into breast milk versus the other ones. So what the FDA did was put it in two categories, A through X. A is totally safe. It's been observed being taken in pregnancy. No harm to fetus, no harm to mom, we're good. Category B says animal studies fail to demonstrate a risk to the fetus, but there's not enough trials in humans to know whether or not it will be an issue. Category C is in animal reproduction. It has shown adverse effects on the fetus, but there's not enough studies in humans to say whether or not it is absolutely harmful. And if you read there, it says potential benefits may warrant use of this drug in pregnant women despite potential risks. So category C is pretty much the gray area, and guess where the majority of psychiatric medications fall? In category C. And I'll give you an example where taking something like an SSRI during pregnancy is way more beneficial than not. If a woman is severely depressed, unable to get out of bed, not eating, not getting enough sunlight, not moving, the harm of that depression on her body is probably greater to the fetus than if she were to take a medication to help her move a bit more, eat a bit more, sleep a little bit better, even with the potential possible risks of taking a medication. Or if a woman is having severe anxiety, severe panic, all that adrenaline, cortisol, epinephrine, norepinephrine in her body can cause damage to the vasculature of the baby. Or women with ADHD who get pregnant. You know, there's this concept called pregnancy brain, right? Where you're like less cognitively acute when you're pregnant because of all the demands, the metabolic demands, the energy demands of, sustaining life. Now imagine on top of that ADHD, and then you take away the ADHD medicine. Pregnant women with ADHD are far more likely to get into car accidents if they're left untreated because their attention span and their concentration is totally off. So as you can see, there's a case-by-case basis here, and a prolonged discussion should be had with the doctor, right? There's no absolute no's and absolute yeses. You want to work with your patient as the doctor, at least that's how I approach it. Find the best fit, what we're most comfortable with. Category D is essentially like Category C, but just a little bit more pessimistic. And Category X is absolutely contraindicated. Like, we know this medicine absolutely harms the fetus. Now here's a resource I like to use. It's called mother2baby.org. And you can look up any medication and it'll give you a fact sheet. And the fact sheets are written in plain English. It's not written in like academic medical language. And it answers questions like, does fluoxetine increase the chance of miscarriage? Does taking fluoxetine increase the chance of birth defects? Does taking fluoxetine in pregnancy increase the chance of other pregnancy-related problems? I think mother2baby.org is a wonderful resource. I tell my patients to look at it all the time. I look at it all the time. But the way I see it is that it is always a case-by-case basis. And you don't necessarily need to absolutely suffer during pregnancy if you're dealing with anxiety or depression. This is an important conversation to talk to your doctor, your psychiatrist, and your OBGYN about. Let me know if you have any other questions below.